Flu kills. And in fact, it kills as much as 25,000 people a year in England and Wales during severe seasons. So clearly, this isn't just a cold. It's much, much more. All the more reason to be able to recognize the differences between the flu and other similar conditions like colds, pneumonia, and coronavirus, but how to prevent the flu, how to treat the flu. And speaking of which, I am going to have a treatment option you may not have heard of before, as well as talking about why are we all getting so sick recently? So, how do you know it's the flu? It's actually quite tricky, and it's tricky to diagnose as well because it does have similarities with other conditions. Let's start with the cold. The condition that is often called the flu, but it is not the flu. You see, colds creep up on you slowly and give you that runny nose, bit of a sore throat, cough. It's the sort of thing that's going around. It's miserable, but not dangerous. So you're probably able to soldier on with your daily bits and bobs. The flu, on the other hand, hits hard and it hits fast with runny nose and aches and pains and fevers and feeling super fatigued. Not the sort of thing that you're happy to go on about your daily bits and bobs about. Much worse than a cold. COVID is a tricky one because it can cause a lot of different symptoms, often very similar to the flu itself. But if you find you get loss of sense of smell or taste, that is more likely to be coronavirus than the flu virus. Additionally, if you're lucky enough to have access to those lateral flow tests, those swabs, then use them. They can be gotten from pharmacies. Unfortunately, they're not free anymore. But if that's positive, obviously that points you towards COVID rather than the flu. Pneumonia can follow the flu actually, but it's slightly different in that it is a pocket of infection purely on your lung, on your chest, that often gives chest pain, shortness of breath, high fever, and really just does not let up. And that's the sort of thing, they're the sort of symptoms, in addition to coughing up blood, that you really should be getting medical help for. I think this is complicated. I think there are a few different answers here. One of them, I believe, is COVID, coronavirus, that pandemic that none of us are going to forget too soon. It's becoming more and more apparent that these COVID infections are having harmful effects on us. Not just long COVID, but more and more issues with our immune systems, and perhaps that is part of why we're getting all these infections. I think there is also an answer to the question of why do we call a cold a cold that tells us why we're all getting so sick at this time of the year as well. During winter, the temperature goes down, it gets colder. That doesn't directly make us sick, but it does a few different things that increases the chances of us getting sick. The lower temperatures and the drier air makes it easier for viruses to replicate. Add in that our immune systems are often a little bit less powerful during the lower temperatures. Add in that vitamin D deficiency is prevalent everywhere in the UK, especially during the winter months where we're not getting any sunlight. But finally add in what we do when it's cold. We all huddle indoors, we put the heating on, and we close the windows. We reduce ventilation. So if one of us is sick in the room or the building, we are all going to breathe in that air, and it's going to allow these viruses to spread like wildfire. So if you've got the flu, what are you going to do to help yourself get better? Well, because it's a virus, there isn't really a quick cure for it. We've got to do what we can to boost your immune system to allow you to kill it yourself. And there's a few things you can do with that from that regard. You're not going to feel like doing much. It's probably going to floor you, this illness. And that's your body telling you you need rest. Rest is one of the best things for our immune system. Add in on top of that fluids and vitamins, specifically vitamin C and vitamin D, might give your body that little bit of fuel that it needs to fight this infection. Don't be afraid to take symptom relief either. Now, I know that cough medicine over the counter is close to useless, but at least paracetamol ibuprofen to help with those aches and pains and those fevers will make you feel a little bit better while your immune system does the heavy lifting. Now, here's the medication you may not have heard of before, particularly if you're in a high-risk, vulnerable category like the elderly or the people with poor immune systems. That medicine is Tamiflu. Now, Tamiflu is certainly no miracle cure, but it might help, especially if you can get it within 48 hours of your symptoms starting. It could reduce the length of your illness, and there's some evidence to say that if you get the drug within 5 days of your symptoms starting, it might help too. But really, it should be in the first 48 hours. So if you feel you're high risk, get chatting to your doctor in case you're eligible to have Tamiflu. One of the most effective ways to prevent flu, or at least make it less severe if you do get it, is through vaccination. Now, the NHS does provide vaccination to a number of specific groups, but you can also pop into a pharmacist and pay for it if you want. Those groups are everyone over the age of 65, pregnant women, people with chronic health conditions like asthma or diabetes, health and social care workers, and all children aged 2 to 11. This one is as a spray up your nose rather than an injection. So if you qualify, get booked in and get that flu vaccine. And I've already touched on some of the other ways to prevent you getting the flu. If you're not exposed to it, then you can't get it. Now, I know avoiding people, although some of us would probably like to do that completely, avoiding people isn't always possible. But there are ways to make sure there are less virus in the air that can get into your body. Ventilation is probably top of the list, really. If you can open a window, yes, it's cold, but opening a window gets fresh air in and disperses that virus. It might not sound like a popular one, but face masks do, if you've got the good quality ones, do help prevent transmission as well. And avoiding crowded spaces. The less people there are there, the less likely you're going to be breathing in each other's air and potential flu virus. So that's a little bit about the flu anyway. I really hope you don't get it. I hope you don't have it, but having had it myself, I know it's bloody miserable. You will get better as long as you look after yourself. But remember, you're not supposed to be a doctor. You're not supposed to be able to self-diagnose everything. So if you do have worries or you are very unwell, do contact your healthcare professional. Thank you very much for watching and see you again soon.